Good evening, Los Angeles. Thank you again for joining me for my daily briefing on letting you know what's happening with our heroic fight to slow and to win the war against coronavirus here in Los Angeles. I know these times have been tough, and I want to start tonight by again just speaking to you about how difficult these days have been. I know that it's easy to feel scared or lost, to feel unmoored from the usual things that are the foundation of our life. But even as we feel unmoored, there have been amazing anchors of generosity that we've seen all around this city. We've seen the woman who posted on Nextdoor asking if she could pick up groceries for senior citizens who live in her neighborhood. The synagogues that are calling people just to let them know you're not alone. Folks across the city that have given to our emergency COVID-19 crisis fund. These are acts of generosity, acts of kindness. I'm so proud to be an Angelino and to be your mayor. I'm also so proud to work hand in hand with mayors across this county and our county board of supervisors. But I want to talk to you personally tonight a little bit about your health. And I want to make sure that you're taking care of yourself as we all hunker down in Los Angeles. These can be very tough days, and you might be asking what you can do to relieve the stress that you're feeling. Here's my advice. Check in with loved ones. See how mom's doing. Call a friend you haven't talked to in months or even years. Reestablish real human contact. Don't just stay on the internet reading the stories about the crisis, but make sure you have time to hear, to smile, to laugh, to interact and to listen with people who are, for all of us, the foundation of our stability. Make a plan, and if you're depressed or feeling down, determine what can you do tonight to feel strong again. And if you need help, it's out there. Don't be afraid to ask for it. Thanks to our Los Angeles County Department of Mental Health, there's a hotline that you can call at 800-854-7771. Or if you prefer to text with somebody real, use the crisis text line and initiate a conversation with trained counselors by texting HOME at 741-741. But bottom line, reach out to each other, interact with each other. Life will continue, and we will get through this. Next, let me catch you up on the latest news since yesterday. By now, I can see that we all understand how important social distancing is in this fight. It is our largest and most important weapon. That's something that pushes the day off that our healthcare system will be overwhelmed by the number of cases that we have, a day that all of us hope will not come. But in the face of that problem, our most promising solution is you. The power is in your hands. The choices that you make, the distance that you keep, these will be the factors that determine how this chapter of our city's history is written. And nothing is more important right now. As you heard today from the Department of Public Health for Los Angeles County, there are now 190 confirmed and diagnosed cases of COVID-19 in LA County. Remember, these are only the numbers of positive tests that have come back. Too few people are being tested, and there's a delay in those tests of 4 to 6 days. So this is really a snapshot of a few days ago and a reflection of the testing capacity as it grows. I want to remind everybody that all of us are safer at home. Let me repeat that. All of us are safer at home. That is the direction of the Department of Public Health. That is what the science tells us. And that is what we've seen across the country and across the world. We know that this is the right way to respond to the pandemic. Listen to our county health professionals. They have been clear. If you can stay home, stay home. If you can work at home, work at home. Only our critical workers should be going to work, and they should practice social distancing whenever humanly possible. And I can see that Angelinos are answering this call. What seemed impossible on Sunday when we took some of the boldest measures in the country have resulted in quite empty streets, shopping malls that look like ghost towns, schools that are closed, and buildings that are a small reflection of what they once were. I know that can seem unsettling, but those pictures are good news and proof of the progress you are making. I know that critical workers and members of the public still need to get to work in some cases and, of course, get to the grocery store or pharmacy. and many Angelenos depend on public transportation in LA County. So let me give you an update there. Our residents have to ride those buses and trains to get them where they need to be. So I want to reassure people that LA Metro will keep running those buses and those trains. They'll be talking to all of us a little bit more on Friday about the way they're adjusting schedules, but I want to reassure people that it will never close. In fact, we need to make sure that our nurses, medical assistants, folks who are cleaning our hospitals, our grocery clerks, and others who don't have their own car and have no other options can continue to get to work. Metro crews have been cleaning religiously, adding all of the extra cleanings to make sure that those spaces are safe, and we ask riders to make sure that they also maintain as safe a social distance as possible. The agency will, as I mentioned, release more detailed information about those ridership numbers, about any operational changes, but I want to reassure people that you can still go Metro to do the critical work that you need to do if you're a critical worker, and to do those errands that we all will need to do throughout this crisis. As with Metro, we continue to coordinate across Los Angeles County with our partners. And I want to thank County Supervisor Catherine Barger and Long Beach Mayor Robert Garcia, who led a call today with the 88 mayors of Los Angeles County, a planning meeting, and we heard from mayors from Avalon to Whittier, from Calabasas to San Gabriel, and beyond. It was a call to discuss how we can all plan to be safer at home and to prepare for steps that we probably all feel are inevitable in the days ahead. As we coordinate together, copy best practices, and ensure that there are no loose ends of one city's gymnasiums open while other ones are closed, and that all of us are reinforcing that it is safer at home and that we all have that work to do. How can we travel less, see fewer people? How can we telecommute and still do our jobs? I'll reiterate what I said last night, though, because I know it's on a lot of your minds. Shelter in place and lockdown are not phrases that we should be using. Shelter in place, they're the wrong descriptions to describe not only what we see here, but even in those places that sometimes are described with those terms, in San Francisco or San Jose. Shelter in place refers to stopping where you are, usually almost always not at home, during a public safety emergency like a school shooting. And lockdown implies that people literally cannot leave their home or wherever they are. Today, the unprecedented measures and closures in our city and across our country and county, continue. But every day, every hour, we are monitoring this situation and evaluating new orders. And let me assure everybody, I will be prepared to take whatever steps are recommended by our county in coordination with all of the cities across this county. We are all safer at home, and we hope that you will continue to do just that. This isn't LA's first emergency, so let me turn next to the great action that we saw from our city council, and I want to thank council leadership and council members who spent an entire day making sure we were ready to meet this challenge. I want to reassure those residents of LA City, our reserve fund is at twice the level it was, a record level, and twice what it was before the 2008 Great Recession. And because we did plan ahead and we socked those dollars away, we were able to work together with the City Council to secure $20 million out of the reserve fund. I want to thank our chair of our budget committee, Paul Krikorian, and council leadership for creating the COVID-19 Emergency Response Fund, to put the full might of our government behind the response, to buy the things we need, to offer the relief that we can while we wait for even more federal and state assistance. With the new emergency fund set up, we will have the tools we need to ramp up clear and coordinated actions in the face of the pandemic. And in the spirit of mobilizing every resource at our disposal today, I activated the Disaster Service Worker Program, something under the powers that I'm accorded in the Charter. This is a step that allows us to redeploy any city employee necessary to combat this crisis, including our efforts to house the homeless. As we ask people to remain safe at home, we know that too many Angelenos don't even have that option. They have no home to go to. If we do not act now, this pandemic could see our homeless population disproportionately affected, and they already disproportionately have the underlying health conditions that make them the most susceptible to morbidity. In simple terms, they are the ones who disproportionately could die as a result of this crisis. As many Angelenos know, long before this pandemic reached our communities, we've rolled out in the county of Los Angeles, thanks to the voters, and across our cities, many comprehensive strategies to combat homelessness. I think, stood in this room less than a year ago saying we needed a FEMA-level response. And while we've seen some more dollars come, thanks to Sacramento and Governor Newsom and our legislature, and negotiations commence with our federal government, we may finally be getting some of those dollars that we need in this crisis to bring our homeless home and to address this public health emergency. We have launched before the crisis the swiftest deployment of shelters anywhere in America, alongside adding new supportive permanent housing units, expanding our existing stock of affordable housing, and providing vital sanitation and health services to folks both living on the street and people living near them. Over the past 19 months, we opened 12 new bridge home shelters, transitional housing shelters with 813 beds, and another 14 are due to open before July 1st. But we needed to ramp up this momentum during a crisis like this. We didn't have to wait to get moving on steps to help our homeless residents as COVID-19 spread began. We're ready, willing, and able to activate this coalition we've already built and get to work. We've already changed our engagement strategies on the streets of LA City, and I know throughout LA County, acting quickly to keep our 500 winter shelter beds open now until September, and training our outreach teams to support social distancing on our streets. And we've delivered now nearly 300 hand-washing stations and 120 mobile bathrooms at encampments because good hygiene practices remain an important tool in this fight. And while we have 0 confirmed COVID-19 cases among the unhoused in Los Angeles, we know there are probably cases out there and this could change any moment. So I've directed our city to launch an unprecedented effort to move folks to safety. As we make thoughtful and strategic plans in the days ahead, we're working to identify those who are the most vulnerable out there, instructing our Homeless Services Authority throughout the county to identify the 4,000 individuals who are most at risk, those ones who have the underlying medical conditions and who are of the age where morbidity is higher with coronavirus. During this emergency, we will suspend rules that require unsheltered individuals to take their tents down during the day, making it easier for this at-risk population to practice safe social distancing and remain visible to outreach workers who are focused on getting them crucial services. But we are going to work to relocate vulnerable Angelenos indoors, into low-barrier congregate settings with the proper spacing, and into some shelter spaces that have been in the pipeline to open in the near future. So let me announce what we're going to do today. With our partners at the Los Angeles Homeless Services Authority, the City Department of Transportation, and LAPD, we're going to deliver 6,000 beds at 42 recreation centers across the city of Los Angeles. By the end of this week, we will bring more than 1,600 beds online in 13 recreation centers. That will be the first phase. These beds are being provided by the American Red Cross, and let me thank them tonight. And if you have even a little extra cash, they're a wonderful place to donate to. It will be paid for with city dollars, state aid, and federal dollars through FEMA reimbursements. So if we take these emergency shelter beds and add in our bridge home shelter beds, this means we can bring 7,000 unhoused Angelenos off the streets and in emergency housing, the most in recent memory, maybe ever in this city's history and at least in a generation in this country. And we are in touch with federal and state officials for additional properties and places where we can bring these folks indoors. We have the supplies, we have the space, and we are prepared for this task. In the days ahead, I will call on dedicated public servants in our city to help us meet this moment. And I can't thank those homeless service provider community workers enough. We've said a lot about grocery clerks being heroes, of course our doctors, nurses, janitors in our hospitals, our first responders. But you too are amazing workers meeting this crisis, and I want to thank you for showing up to work. I want you to thank you for doing some of the hardest work there is out there even before this crisis, and you are on the front lines. We see you, and we appreciate you. We are here to support your teams and to surge people to work with you. So we will have those city workers and county workers in a safe environment with police there for security to make sure that each one of these areas is a place where folks who are not exhibiting symptoms but are vulnerable to it can be safe from COVID-19. To be clear, people will go through triage before with county public health workers, and those who do have symptoms will be taken to medical care by the county. These are for the rest of the population to stay safe, and anybody who exhibits symptoms in these shelters will be connected with that care immediately as well. In a moment of profound need, I'm so grateful to the men and women of this city and this county, people who have shown up to lead and who challenge others to do the same thing. We will also now have new funds and flexibility because of good news we heard today from our Governor Gavin Newsom with his work with our state legislature. The legislature and he announced yesterday that they had stepped up with bipartisan support to invest $1 billion in California state funds to meet this challenge and this crisis. And out of that investment, Governor Newsom today announced that $150 million of that would immediately go into homeless housing solutions. What that means for Los Angeles and for our region in this crisis is that close to $37 million in additional resources are on their way to serve and to support our unhoused population, along with extra funds to help us purchase or master lease hotel and motel rooms. The use of 660 travel trailers that will come to Los Angeles County in case we need to isolate homeless Angelenos who contract the virus, and the flexibility to streamline and cut red tape in the process to build shelters and facilities so that no excuses get in the way of the urgent action that we need. These are critical steps for our city and county and from our state, and I want to thank our state leaders for stepping up. I also want to thank the state for sending 5 million masks for our LAHSA homeless service workers who are out there on the front lines, everybody from doing sanitation work to outreach work to folks in our shelters. We're going to keep you healthy so you can keep keeping the folks out there healthy as well. In conclusion, over the last few days, I've been prepared to take whatever steps are necessary to protect my city and to protect all of us who live here. I couldn't be prouder to do that with all of you. We've raised nearly $200,000 in the COVID Crisis Response Fund at corona-virus.la, and we will be sharing those dollars this weekend, to organizations that are feeding and helping, who are arming us for the fight with the equipment that our first responders need, and conducting research on this crisis in real time to inform our decisions as quickly as possible. But none of us should have any illusions about the challenge that we face here today. There are still tough days ahead, and I'm prepared to step up and take up whatever necessary steps to protect Los Angeles based on the advice of this county, now rather than later. I'm so proud of you. I'm so proud of our city, inspired by your resolve. And I know that when we look back at this moment, if we do everything that we can, whether it's helping people come off the streets at this moment, whether it's limiting the social distancing to finally flatten the curve, or whether it's just thanking each other and reaching out, so this isn't a moment of social isolation even when we have social distancing, we will look back and say, this is yet another example of how the city can lead with love, how our city was resilient, and how our people continued to persist even in the toughest moments. Thank you all, strength, and God bless you. With that, I'll be happy to answer questions, and as usual, I'll come back and say some words in Spanish. I think I'll just take questions in English tonight, with time permitting. Thank you. We'll take the first question.
Hello, Mayor. Our first question comes from Laura Nelson with the Los Angeles Times.
Hi, Laura.
Thank you all. Strength.
Laura, are you there?
With that,
Hello, Laura.
as usual.
Yes, I'm here.
Go ahead.
Mayor, is the action that you're announcing today to temporarily house the homeless, is that a way to get ahead of tomorrow's federal court hearing about homelessness and the coronavirus? And if not, what will the city tell the judge tomorrow about your efforts to stop the virus from spreading through homeless encampments?
Just what I shared tonight, and no, this predates it by at least 2.5 weeks. Even before we knew about a judge in a meeting, I authorized our team to begin drawing these plans up 2.5 weeks ago at the beginning of this crisis, saying never let a good crisis go to waste, and looking at the possibility finally of getting those federal FEMA-like dollars because of the public health aspect, which, by the way, I've said this homeless crisis is from the beginning, that this is as much about public health as it is about housing and anything else. But luckily now that we have that option, and we believe that will be federally reimbursable, the state stepping up with even more emergency funds, we know how it will be funded. But before we even knew the money, long before I even knew who the judge was, and I'm very excited that this judge will be there, I'll be just sharing this and reiterating this with him tomorrow, and any other questions he has. I think that he has shown in Orange County that no neighborhood, no city should ever say, not in my backyard. He's been a real strong common sense person who's helped places like Santa Ana get shelters up in 27 days. And I really look forward to working with Judge Carter. I'm excited to be there, and I and the chair of the Board of Supervisors, Catherine Barger, will be there at the outset. He's asked us to come. I welcome that. It's close by. We can practice social distancing, and we'll look at ways he can help during this crisis. And I've asked my team in the midst of this, when we started this, we aren't just going to look at what we can do to get people off the street now, but what can we do to make sure as many of those exits when this crisis is done don't just return to the street, but hopefully return to housing. Thanks, Laura.
Thank you. And our next question comes from Christine Smiduk with the Wall Street Journal.
Hi, Christine.
Hi, thanks for taking our questions, Mayor. I appreciate it. Going back to you said 7,000 unhoused folks that you hope to get into housing as part of this capacity building during this phase. That is a significant chunk, but there's tens of thousands of unhoused homeless in LA County, and I'm sure that there was a capacity problem even before the COVID-19 situation hit. So at this point, is there a prioritization happening?
Yes.
To focus on those who are seniors or those with pre-existing health conditions? And also, is there any mind to decreasing the kind of the density of existing shelters, given that could potentially lead to more, conditions that might breed more outbreaks or
Sure.
let them spread faster?
Great question. It was my understanding that LAHSA has already worked with existing shelters to make sure, together with county public health, that social distancing is going on and that spacing in existing shelters. I think I said earlier that there was 4,000 that are prioritized that LAHSA has identified. Luckily, we have more information than ever before about who's on the street, what their names are, what their conditions are. And so the prioritization will be for folks who meet both that age and that pre-existing condition. A lot of people have said, what if they won't go? I want to say very clearly, people on the streets, by and large, the great majority of them, do not want to die on the streets. I would venture to say all of them. And so this isn't about forcing people onto a bus. This is about letting people know if you stay out here, you are at great risk of potentially dying, and making sure they know that there is a place to go where they will be fed, where they will be warm, where there will be workers with them, and where we will make sure that their lives are protected. For folks who aren't there, who don't get on the bus or aren't going into shelter, we will, of course, be on the streets, making sure that there is social distancing between people on the streets. Tents that are back-to-back are a violation of that. We want to make sure that people know that so that they can protect their own health. And we'll be doing that same thing that we do throughout the city right now with folks, letting people know that if that's in violation, they need to space themselves out. So the first 4,000 will be prioritized that way. After that, by the way, some of those people may have families. So in each of the police bureaus, we're also going to set up places where homeless families can go that might have members that meet those conditions, but a family shouldn't be in one of those other aggregate shelters. And in terms of the rest of the county, I hope this can be a great model for other cities and in the unincorporated areas of the county, et cetera, who I know are working really hard on the hotel-motel side, and potentially a model like this at their rec centers. But this was from our city's emergency plans. When we have an earthquake, when we have some other issue like fire, we have a set of rec centers that are already plugged to go. That's what we are mobilizing because this is an emergency. I'll take the next question. Thanks.
And our next question comes from Carla Hall with the Los Angeles Times.
Hi, Carla.
Hi, Mayor. Hi. I sort of referring to the question you got about density at the shelters. Is it feasible to? I mean, how would you practice social distancing, I mean, would there be partitions between cots? Would you have a set number, like a high number that you will not go beyond in terms of putting people in shelters? And when someone tests positive, if that happens, hopefully it won't, what about all the other people that had contact with that person?
So working backwards, our public health will be in charge of that, as they are everywhere in the city, and give us advice in terms of what they think that exposure is and whether multiple people who are close enough need to all go into some quarantine or just that individual. These numbers all reflect, from the beginning of this, we did this with the COVID-19 crisis in mind. So this wasn't some plan where, oh yeah, we can stick beds within a foot from each other. That distancing is there. It's not with partitions, is my understanding. But the public health professionals in LA County are the ones who wrote this plan with us and gave us the advice, essentially. So we feel confident in their advice. They're the professionals who are giving us that strict guidance. And we will not put more people into those than they can contain. If one is full, it is full. We'll have to look for other sites if necessary moving forward, but we will not compromise those public health rules simply because there's others who want to come in. But we do know that this will phase in over some time. Some people will say yes the first day. Some people will hear the word about it, come in the second day. Others might be challenged, and it will be in the coming weeks. But we know that even on the streets, people know what a threat this is to their health and potentially to their lives. And I think we are confident the more that we can go back to them, let them know that those numbers will come up and we'll be able to fill that. It would be a great problem to have if we get them all in there. But before we talk about more, which I know the previous question was about, this is unprecedented. I mean, we're talking about 2,300 beds for bridge home shelters that took us about 18 months, and those were moving pretty quickly, sometimes 90 days. We're talking about 1,600 beds in a matter of 3 or 4 days right now, by sometime, hopefully over by the end of the weekend. And then an additional, beyond that, to get to 6,000 beds in the coming week after that or 2 weeks after that. This is an unprecedented logistical undertaking. But thanks to the Red Cross, thanks to our Emergency Operations Center, and to our city employees, people have the confidence that we can do that. I would not be announcing it if we didn't feel we could get there. Next question. Thanks.
And our next question comes from Rosa Ordaz with KNBC4 News.
Hi there.
Yes, hello, Mayor. Thank you for taking our questions. What about funeral homes and services? Can they continue with social distancing? And also, last question, where is coronavirus czar Matt Johnson today?
I don't know where Matt is today. I know he made a lot of phone calls. We practice social distancing, so he may be either working from home or another room in here, so we don't see each other. But he has made a number of calls. I think we'll be announcing some of the great support that is coming in from foundations and others. He's been very focused on support for the shelters that will be standing up. For instance, the meals for these places. We've reached out to the United Way, and he's been working with them and different foundations to make sure that we can get the meals for 6,000 people to these sites. We also hope to work closely with council members to say, hey, put a council staff member in each one of these. Let us know which restaurants are suffering nearby. Maybe we can help keep them afloat while we house our homeless individuals as well. What was the first part of the question again? Sorry.
What about funeral homes and
funeral
services?
Homes.
Can they continue with social distancing?
I don't have an answer for that. It hasn't been a prohibited one, but I know with county health we're looking at some additional measures that we could be announcing as early as tomorrow. So I'll see if funeral homes are a part of that, but I'll have to get back to you on that. Next question.
Thank you so much, Mayor.
Thank you.
And our last question comes from Steve Gregory with KFI Radio.
Hey, Steve.
Hey, Mr. Mayor, good evening. Thank you so much for taking the call.
Of course.
I just want to ask you, you said before, earlier on in your comments, that you are prepared to do what it takes to protect the city of Los Angeles. And coming off of the comments from Dr. Ferreira this morning when she said that the cases will continue to rise and continue to do so up, I guess the next 12 weeks, she even said. How close are you to declaring a quarantine-in-place order, and how close are you to shutting the city down?
So again, I avoid both of those, not because I'm afraid of saying them. I just believe them to be inaccurate. Folks, for instance, up in San Jose or San Francisco are not only able to, but encouraged to go to the market, to walk in the park, to take a hike as long as you maintain social distancing. I want to be able to emphasize all the things that we can do, all the work that will continue, the exemptions they have in places like that for critical construction work that we have, continuing to build housing and our infrastructure. They have folks who are doing critical financial work to keep people's books balanced and going, et cetera. So I don't ever see a lockdown, and I don't ever see a mass quarantine in place. But let me be very clear. We are urging everybody that it is safer at home and go home if you can. And we will, when I said I'm ready as soon as tomorrow or whenever we get the instruction and the advice from LA County to go further in restricting those movements for non-critical people. And I think we see that history written out there. LA took the biggest and boldest steps in the country on Sunday. If we need to do that again tomorrow, the next day, over the weekend, whenever, I wanted people to know I'm prepared to do that immediately. So thank you.
That's all of our questions.
Thanks for the questions. I appreciate it. Thanks again, everybody who tuned in. I'm going to say some words in Spanish as well. And I appreciate everything that each one of you is doing to make sure this city is strong, gets through this. As always, if you don't live in the city of LA, please contact your local mayor, council, and city government. We all were on the phone together, but we know that sometimes it's a little different in different parts of the county. But rest assured, we are acting like one city more than I've ever seen, and I appreciate the county leadership one more time. Muy buenas noches, angelinos. Gracias por su presencia esta noche. Aún durante esta etapa difícil, hay grandes ejemplos de generosidad social por toda nuestra ciudad. Son actos que me dan orgullo de ser un angelino. El distanciamiento social es necesario. Es nuestra arma más poderosa. Nos ayuda a evitar que nuestros hospitales sean sobrepoblados con pacientes. Tienen que estar preparados. Ahora tenemos 190 casos de coronavirus confirmados en el condado de Los Ángeles y muchos más que no se han confirmado todavía. Todos estamos más seguros en casa. Con el número de personas tomando transporte público que ha bajado, podemos ver que la gente lo están tomando en serio. Mantenemos los trenes en operación para muchas personas, incluso los primeros intervinientes. Hoy yo organicé una llamada con los alcaldes de las 88 ciudades en el condado de Los Ángeles, con la jefa del board de supervisadoras, Catherine Barger, y el alcalde de Long Beach, Robert Garcia. No hay un cierre entero de la ciudad. Hasta hoy, las mismas restricciones aplican, pero todos deben estar preparados por nuestros próximos pasos. Logramos colaborar con el Consejo Municipal y gracias a los líderes del Consejo Municipal de la ciudad de Los Ángeles para destinar $20 millones en fondos de reserva para crear un fondo de respuesta de emergencia de COVID-19. Tendremos las herramientas que necesitamos para aumentar nuestras acciones claras y coordinadas para enfrentar esta pandemia. Hoy activé el programa de servicios para trabajadores en desastre para redistribuir cualquier empleado de la ciudad necesario para enfrentar esta crisis. Esta pandemia pone a nuestros vecinos sin hogar en riesgo. Estamos trabajando para identificar ellos quienes están en riesgo, suspendiendo reglamentos que requieren quitar las tiendas y alojando a angelinos vulnerables. Esta semana llevaremos más de 1,600 camas en línea a 13 centros de recreación y más de 6,000 camas a 42 centros de recreación en las próximas semanas. Debido al Estado, tendremos más de $20 millones en recursos adicionales para servir y apoyar a nuestra población inhabilitada. Estoy muy orgulloso de sus acciones y sus actos de amor, de generosidad de las personas en esta ciudad, inspirado por su resolución y nosotros superaremos. Gracias a la gente de Los Ángeles. And again, everybody, strength and God bless you. Thank you.